Hi, yesterday we were talking about the assessment of Prakriti in the OPD. What we ended up with was how do we assess the expected Prakriti? Today, let us look at the same 30-year-old patient presenting in the month of September at noon with a clinical presentation. Say it was an increased heart rate. Now, when we have this condition where the heart rate is increased, that means it is symbolic of Vat being hyperfunctional. It may be assumed that when the heart rate is increased, the heart is supplying more blood to the body. That is incorrect. Basically, the heart is having to perform more, do more activity to supply the same amount of blood to the body in the same time frame, and that is damaging to the heart. When this is happening, this simply means that heart is under stress. Under stress, we acknowledge that aerobic metabolism is not sufficient and there will be anaerobic metabolism. Anaerobic metabolism would mean that there would be the byproducts in the form of some acidic substrates that would be generated, and these acidic substrates would cause injury to the cardiac muscles at the local level. Now, as we get into this diagnostic element, we also have to look from the Ayurvedic perspective that it is not just the heart but even the lungs that are affected, because it is seen as a complex known as Pranava Srotas. In this element, we know and we see that to perform its functions, like all tissues, heart will need what is called the resources. The resources will come from the hepatic vein feeding into the inferior vena cava, and from the liver it is the assimilated metabolized food which is further distributed to the rest of the body through the heart, so that there the more important elements of assimilation, metabolic activity and metabolic absorption, utilization are performed. Heart itself will also be nourished by the same resources at the same time. Now, when the heart is receiving these resources, these are rich in carbohydrates, fats, proteins, but since in this case the heart rate is increased, the heart is deficient of aerobic nutrition, and before it gets enough oxygen to aerobically perform its functions, aerobically metabolize these resources, they are first available for anaerobic utilization. So the cycle, while this will go through the pulmonary artery and come back from the pulmonary vein in the form of oxidized blood, the unoxidized blood with the nutrients in there are already available and are under the process of anaerobic utilization. This leads to gradual injuries because of altered pH environments in the heart, because of production of acidic substrates following anaerobic utilization, and those substrates are also sent through the pulmonary vein to through the pulmonary artery to the lungs, so the lungs are also exposed to the same byproducts. This complex then is seen as an impact to Pranava Srotas. Now, this finds relevance because if we look at the case we discussed yesterday, then in that case we had an increased Pitta as a normal condition, but in the presenting clinical condition, Vat which was also relatively increased by virtue of the expected Prakriti, here was now more aggravated. This superimposition or this modeling is to be understood. This sadly is not uh, detailed in any mathematical form. The derangement as a bias on the curve going above or below than expected is nowhere represented. The mathematical statistical form of representation, which is the laboratory model, is missing. IRScan, I'll once again come back to now, is something which is looking to achieve all these for you. All these things are presented in IRScan only to assist you with your clinical diagnosis in much more depth, Srotas wise, that is organ system wise, and their correlative impacts in the progressive disease form on various other organ systems. It is further delving into, at its future levels, associating quantum medicine and quantum applications of modern science and theoretical sciences into Ayurvedic concepts and how this impacts clinical diagnosis in Ayurveda. All doctors, all institutions looking to use this as a tool in their clinical practice and enhance Ayurvedic diagnostic perspectives and presentations. I would request them to comment, share what they are looking for, and I'll be happy to reply to them as far as IRScan is concerned. With this, I will just close by once again reiterating the case that in that case, depending on the symptom, the presentation does suggest that a certain dosh is active or inactive. However, why IRScan becomes important is because IRScan lets you find a standard numerical index to it and makes it easy for you to understand, compare, and inform your patient as to what is missing. Remember, Prakriti is a dynamic equilibrium right from birth till death, and it is not a static property. Thank you.